There's a fascinating new study out. Weight loss, we might know this, it often leads to the dreaded plateau where shedding pounds suddenly comes to a sudden halt. And a researcher at the National Institutes of Health took a look at the phenomenon, found some very interesting things out. Joining us to talk about this, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Great to see you, Doc. And the study's fascinating because kind of a reminder of how amazing the human body is and not always to the benefit of our beach bods. Why do why do the diets fail sometimes?
Yeah, I think, what the study shows is our bodies sometimes even work against us. So what this study shows is about 263 adults is that people who went on a calorie restriction, they will lose weight. They can pretty effectively lose weight, but then at about the 1 year mark, they have a really hard time losing weight. And what they found is that your body likes this kind of equilibrium. It likes to kind of keep things the same. So it works against you and increases your appetite to the point that at about a year, unbeknownst to you, you're eating more calories than your diet restriction was, and you kind of even out. The cool thing about this study is it looked at some of these new medications, Wegovy, Zepbound, and found that, their benefit is in that they extend, although don't eliminate, this period of time to about 2 years where your body doesn't increase your calorie intake to meet your calorie restriction that you're trying to implement to lose your weight.
I found it so interesting to just talk about what our body does. And literally, if you just stay the same, you think you're working so hard, you're doing everything right, and suddenly your body says, no, you're getting more and more hungry. It's just almost impossible to fight that off.
Yeah, and I think that's the lived experience of a lot of people. The first couple of weeks of a diet, you're like, this isn't so bad. I'm losing weight. Like, I'm going to be a rock star. And then, 6 months into it, you're like, why is this so hard? It sounds like we have a bit of an answer.
And a lot of times when you talk to like a nutritionist or a personal trainer, they will always say, cutting calories is not the only thing you should be doing. I mean, what do we need to do to keep the weight off?
Yeah, I mean, that's like the trick here is you also need to exercise, right? So it's a simple equation, despite how hard it is to lose weight. It's this combination of how much do you take in? You want to decrease that. How much do you burn? You want to increase that. That's decreasing your calories, increasing your exercise. Those two things together are a pretty effective weight loss regimen. So
good news that those new things like Wegovy work, but bad news that there is no magic pill here.
Not yet, although I'm sure, some drug company is working on it right now.
Okay, let's talk about our hearts for a second here. A new study says atrial fibrillation, a-fib, it's on the rise for people under 65. What's going on?
This is an interesting study. I think, a lot of us in medicine kind of have in the back of our minds that a-fib is a disease of older individuals, those over the age of 65. We only thought it was about, 2% of people under 65 that developed a-fib. This study that looked at about 67,000 medical charts out of Pittsburgh, University of Pittsburgh Medical Center, found that about 25% of those younger individuals below the age of 65 had a-fib. And they also found that their rate of mortality, their survivability was less, about 1.5 times more likely to pass away for men, up to 3 times more likely to pass away from women, likely related to some of the medical conditions that drive a-fib, hypertension, heart disease, things like that, smoking.
Yeah. Okay. Interesting stuff out there. Dr. Jeff Pothof, appreciate your time.
Anytime.